One of the things that can be confusing to parents and families is that their child may have a range of, for example, in anxiety, a range of different anxiety symptoms. And for children, it's rare for them actually to present with only one anxiety diagnosis. And they often have at least one other. And we have a range of anxiety diagnoses you can identify in children and adolescents, and they're quite similar to adults, with the exception that if, for example, for generalized anxiety, the child is worrying about things that make sense. So the assessment is really important in terms of being sure of what are the different areas that the child is having difficulty, and where does the child's symptoms impact their everyday life, in school, at home, with their peers, so that you can really develop a treatment plan that will help in all of those areas. We have very good evidence-based treatments available for children and adolescents with anxiety disorder. There still can be a percentage of children that don't respond. They may get a little bit better, but they may still have symptoms that are really quite impairing and difficult for them. The report's about 30 to 40% when you look at what we call a really excellent response, meaning minimal symptoms and not leading to functional impairment. We realize these first-line treatments are good, but when you really look for more of that excellent responder status where the child is really functioning well. In thinking about children and families that find that they've tried very hard and they've had an adequate dose of first-line treatments, whether it be a psychotherapy or a medication treatment, what are the other options? And certainly one thinks about, did they miss a diagnosis? Are there other comorbidities that should be targeted? Are there other environmental factors that need to be addressed that one may not have identified or becomes more obvious? So all of those things need to be examined, and once those things are addressed, what still are we left with being able to help a child or an adolescent that is still struggling with anxiety symptoms? And the truth is, there's really limited options, and what we see is our, certainly for clinicians, trying to turn to other compounds that, in particularly certain types of classes of compounds, like the atypical antipsychotics, as a way to try to treat more refractory anxiety symptoms.